Welcome back. President Cyril Ramaphosa has moved the country to adjusted lockdown level 2 from today. He says it's only a matter of time until the whole country is in the third COVID-19 wave. Well, for more reaction to the president's address, medical expert from the Progressive Health Forum, Dr. Aslam Dasoo, is joining us here on the Midday View on ANC. Good afternoon, sir. Thank you very much, Doctor, for joining us. Just an overriding question first. As a health professional, are you satisfied with the restrictions, the way they're coming? Because some quarters were expecting a tightening of level 2 when the president was going to be announcing the adjustments, but it looks like it's not that tight. What's your view?
Hi, good afternoon, Dan. Good to be with you. Look, I think what we heard yesterday was probably inevitable. I think the government has little room to move at this point. And the restrictions applied, this adjusted level 2, does a couple of things, and the most important of which, I believe, is to restrict gatherings. Now, we know that gatherings are the nidus of infection and of spread, and I'm very pleased that we reduced the number of people who can congregate indoors. It is far too high at this moment still, and the curfew may have some kind of effect. I'm not sure what it will do. But I think what it speaks to is the inability of the government really to restrict economic activity to the point where, we've had it in the past where it actually damaged the economy. So I think it's a far more nuanced approach. It's not the main issue, though. I think there were two main takeaways, if I may, from his speech. The first is that he exhorted us to get through this wave, to survive this third wave as best we can, given the low rate of vaccination, and we can talk about that. And the second issue was to get vaccinated as soon as possible.
Okay, I want us to explore these two aspects. We need to get through. That will talk to our behavior, and let's get the vaccines rolled out quickly. That will talk to the supply of Johnson & Johnson and the speed with which that is delivered. But before we get there, Dr. Dasoo, the restrictions to gatherings, you said it's still high. 100 people indoors, 250 outdoors. What, in your medical view, could have been the right number?
Well, I can assure you that the algorithms have been done. Certainly, Massachusetts Institute of Technology did the most definitive algorithm, which showed that any more than 10 people, among whom there is one infection, has an exponential rise in the number of people to whom it spreads. So 10 becomes a kind of mathematical number to work with. I would have preferred something closer to below 50, closer to 20, if possible. And I think this would have been possible if we were to prevail over the major social lobbies like the religious groups and others, where we see a huge degree of complacency. As much as they may be trying to keep people at a distance, it's not easy. And we see this, we saw it during the recent Eid celebrations at the end of Ramadan, where there's now been an explosion of cases. Yeah. And so I think we struggle with this. So in my view, it should have been much more restrictive. All non-essential gatherings should have been prohibited up until the end of this particular resurgence.
Okay, well, we are not there. We are at 100 indoors and 250. That's what the President and the National Coronavirus Command Council has decided. Now, that being the reality, let's take a look at your two key takeouts very briefly, time permitting. The first one is the President saying, exhorting us, please get through this. That means behave well, wear your masks, physical distance, wash your hands, sanitize. Am I correct? What else does it mean?
Yes. No, it means a heightened awareness all the time. The message is don't get sick. Now, this is very important. If you can internalize that message and take the measures that will avoid you getting infected, you will end up protecting a very beleaguered health system at this point, which, the wave is still to peak, so we can expect much more pressure on an already high pressure situation. So the message is all well and good, but it is wrong to actually blame the people only for having the kind of complacency they have. He did acknowledge that there's some pandemic fatigue, and that's all well and good, and I think that is true. But I think the lack of vaccination speaks to a failure on the side of the government.
Okay, so what must happen? So if the government is failing us, as you say, in terms of the rollout of the vaccination, I mean, in terms of availability, in terms of access, in terms of the pace is so sluggish, it's unbelievable. What should happen in your view then, as we are now entering this phase?
Sure. So at the moment, the government is the only procurer of vaccine. South Africa has the dubious distinction of being one of the countries with the lowest vaccination rates in the world and one of the highest mortality rates. That's a correlation you never want to hear about, but it's true. And I think we need to take a step back and say, okay, if government is the only procurer and is unable to get sufficient amounts of vaccine in, we have organized lobbies, big organizations in the country that can procure vaccine. They should be allowed to bring in vaccine, register it, and keep it in the national pool so that we accelerate the rollout. At the moment, you know, this pandemic throws curved balls at us, like what's happened now with the Johnson & Johnson supply. And this is going to continue happening. So what we need to do is to increase the availability by utilizing every opportunity we have to bring vaccine.
Dr. Dasoo, your point is very clear. Thank you very much for your insights here on the Midday View. That's Dr. Aslam Dasoo from the Progressive Health Forum. Now,